This is just to kind of illustrate the different wards, and you can tell the forensic ones because they're the ones out here on the graph. Okay, and the wards that had the fewest smokers on tended to be the LD wards. So what did we do? Well, we talked about it for a very, very, very long time. Mary nagged everybody a lot, and I started nagging people too, because when I got on board, I'm really good at nagging as well. And we essentially insisted and said to people, you have got to understand that actually we are doing our patients a true and real disservice. Because it's all very well, because we're doing lots of things like we're doing QRIS schools, and we're running physical health clinics, and we're doing exercise clinics. We're doing all that. Meanwhile, we're helping them smoke. So all that good work is for naught. We set up a group. We had essentially physical health champions, and we said because each area is different, and each different client group needs a different approach. Each individual needs a different approach. So we've got a kind of physical health champion. Mary helped train them up so they understood a bit better about nicotine replacement, about the different things you can put in place, the groups, the activities that might help. And we said to them, go away, think about it within your team, and think what is going to be best for your team in order to help facilitate this change. The wards all eventually came up with their own plans. We did a lot of risk management because it's a forensic service, and we were concerned about the potential of increased violence. Smoking cessation groups were run. We included our local GP and GP practice nurse. We got the dietitian and the exercise workers involved, and we approached our smoking cessation advisor and got some help from them. And Mary got some money to get lots of different aids, for example. The stress-busting balls, and we got the pharmacist to help us with nicotine replacement advice for all the doctors, and we had literally everything that you could need to help you to stop smoking. We bombarded everywhere with. We flooded the place. And also there was an important thing about taking a kind of motivational interviewing approach. So the people who were interested were kind of the champions, and they would use very basic motivational interviewing techniques. For the most part, we actually were pushing on an open door. And for a long time, because we were talking about this for a long, long time with the client group, they themselves started to get the idea of, okay, 13th of March, 6 months from now, but we're counting down to it. And we began essentially to do a countdown to the 13th of March. This is just an example of the care pathway. This is something that's done by Mary. So, does the person smoke? Yes, no. If they smoke, how many cigarettes would they like to stop? Yes or no. If they would like to stop, they refer to level 2 smoking cessation, etc. So you could do that for each client who came in. This is just looking at the smoking breaks. Remember that we started doing this for about a year or so beforehand, and because we were telling people you're going to have to start cutting down, each local area started to cut down gradually. You kind of get a clue from the types of wards. My ward is Norbury, that's the forensic intensive care unit. Even we managed to cut down to kind of 6 sessions. The ward that was still on the 14, 13 or 14, that's Wadden ward, and it's actually the dangerous severe personality disorder unit. So they're just very, oppositional. We're not going to do it. That's the staff. Anyway, they eventually, even Wadden did it. Very proud of this poster. This is a poster that was done on Norbury, and everyone got involved in doing the poster. So ROT and Tech developed this poster with the patients, and so every day for about 4 to 6 weeks we had 33 days, 32 days, and it went down like that. And when the 13th of March came, it was a party day. We made it a party, we made it a big celebration of posters everywhere. The activities, lots of sporting activities, etc. Everyone had very careful risk management plans, and we did actually have a few more staffing just in case. But actually, it's kind of all right. And amazingly, so in 2009, there were 300 violent incidents related to smoking, and or 300 incidents, serious ones: violence, fire, absconding. And about 15% of physical interventions, such as restraints, usually associated with smoking-related behaviours. So this graph shows you from December 2012 and what happened with incidents. And contrary to what we all thought, because we did all think, well, okay, there might be more violent incidents, we're just going to go with it. There weren't. In fact, there's been a reduction in the number of violent incidents on average. Big changes, well, the key changes, the things that probably made all the difference. Number one, having someone like Mary, who is just doggedly determined to carry this through. I'm sure you've seen the kind of, you probably see it now, the leader and the follower thing. You need someone who may be a bit ambivalent, but is in a position to be able to make some changes, like me, to help out someone like Mary. And then everyone goes bit by bit. And you do have to get your managers on board, for sure. Pointing out the money issue to them helps. There were lots of focus groups that were done to get ideas, and the patients are very much involved in that. If the patients had not been involved in this from the beginning, it wouldn't have worked. But there was a significant proportion of people who wanted to stop smoking. And actually, now they say they feel better for it. There are people who haven't stopped smoking altogether, but nearly everybody has cut down. We had, the equipment and the resources, that really helps. And actually, you can get a lot of this stuff free, because, via smoking cessation clinics. And also, it very much fitted in with the instilling of hope, because by saying to somebody, I can't really be bothered to help you to, stop smoking, it's kind of saying, we agree with you. Your life is just about this one cigarette. There's nothing, your quality of life is so poor that this one cigarette will do. So we think it very much fits in with the recovery model. Individual care planning. Some people wanted nicotine spray, some people wanted inhalators, some people, wanted to use e-cigarettes. Whatever it is that worked for them. We made sure that, we've got pharmacy input to help us, because people's medication plasma levels will change when they stop smoking. So we did this very carefully with the help of the pharmacists. And, we gave staff training and we supervised them. A lot of the staff are so much happier with it because they don't have to do the whole smoking break thing anymore. It just makes their life so much easier. And of course, we've gained huge amounts of time on the ward. So, finally, I just want to say, if you build it, they will come. Thank you.